Patient ventilator asynchrony is a common problem in the ICU. A 2006 study found that 24% of ICU patients exhibit ventilator asynchrony in more than 10% of their breaths. Data collected by Phil et al. Shows that asynchrony can lead to an additional 18 days on the ventilator. In another large study, involving historical review of more than 51,000 patients, researchers calculated that the average cost per day in the intensive care unit is almost $4,000. With these studies, an estimated cost of up to $72,000 per patient can be attributed to ventilator asynchrony. Ventilator asynchrony is manifested in several forms. Asynchrony is commonly the result of missed efforts, double triggering, and auto triggering. The left graphic shows multiple missed efforts in the pressure support mode. The right graphic shows an asynchronous pattern called double triggering in the assist control mode. Because patient conditions are constantly changing, frequent manipulation of the ventilator settings are required to manage the asynchrony. It is not uncommon for patients to be sedated as a result of asynchrony, and this has been shown to prolong ventilation time. Furthermore, prolonged ventilation time may result in rapid atrophy of the diaphragm and ventilator-associated pneumonia. The end result can be increased risk to the patient, increased length of stay, and higher associated costs. PAV Plus is a unique and powerful tool that can be used to reduce the problems associated with patient ventilator asynchrony by delivering positive pressure in proportion to a patient's own spontaneous effort. Covidien improved traditional proportional assist ventilation by adding the plus. The plus refers to the ventilator's ability to dynamically adapt to changing conditions within the patient's respiratory system by frequently estimating respiratory compliance and resistance. If the patient's condition or effort changes, the ventilator will adapt appropriately, reducing the work of breathing. The PAV Plus software eliminates the need to set traditional ventilator parameters, such as respiratory rate, tidal volume, flow rate, or ventilating pressure. This makes the PAV Plus software easy to use. The clinician simply sets one parameter, called percent support, to give the patient more control over the ventilator. PAV Plus software is a mode of ventilation exclusively available on the Puritan Bennett 840 ventilator. The PAV Plus option offers a form of closed-loop ventilation that automatically adjusts the amount of support when faced with changes in respiratory mechanics and patient effort. The ventilator monitors these changes in two ways. First, it estimates resistance and compliance every 4 to 10 breaths. Second, the ventilator measures flow and volume every 5 milliseconds. This improves the patient's ability to initiate or terminate a breath, which helps to improve patient ventilator synchrony, potentially reducing the work of breathing. The PAV Plus software option provides clinicians with several types of valuable feedback. For example, estimated values for respiratory compliance, respiratory resistance, and intrinsic PEEP are displayed on the upper screen of the Puritan 840 ventilator. Also, the clinician can choose to display a variety of traditional waveforms, including a shadow trace of estimated lung pressure superimposed by circuit pressure. Another source of feedback unique to the PAV Plus software is the work of breathing bar, which displays both total work of breathing and patient work of breathing. In conjunction with other clinical assessments, you can easily see the impact of the percent support setting by looking at the patient's work of breathing indicator on the breathing bar. The green zone represents a normal range for work of breathing. Coupled with a good clinical assessment, the work of breathing bar can help take the guesswork out of determining the appropriate level of ventilator support. It is easy to see the improvement in patient ventilator synchrony when comparing PAV Plus software to other ventilation modalities. This graph shows pressure versus time waveforms for PAV Plus software compared to traditional pressure control ventilation. During pressure control ventilation, the pressure output, shown in blue, is the same with each breath, regardless of patient effort, shown in green. The ventilator applies the same mechanical breath each time. With the PAV Plus option, the ventilator adapts to patient efforts. If the patient pulls gently, the machine applies gentle pressure. If the patient pulls aggressively, the machine applies more pressure. Furthermore, notice how PAV Plus software synchronizes with the end of inspiration better than pressure control ventilation. There are several studies all performed with different methodologies that indicate the Synchrony improvement associated with proportional assist ventilation. Improved patient comfort as a result of improved Synchrony is just one of the benefits associated with using the PAV Plus option. A study by Zirachaki observed low peak airway pressures, which stayed below 30 centimeters of water in 98.2% of measurements. This is attributed to a physiologic control mechanism called the Herring-Brewer reflex, which may protect the lung against overdistension. In a study of proportional assist ventilation, Yunus et al. Found that the need for sedation, as it relates to ventilator asynchrony, may be reduced, and there is less likelihood of overventilation. Because the diaphragm is fully engaged during the entire inspiratory phase, the respiratory pump is active at all times and results in improved hemodynamics. Compared with other technologies that attempt to measure work of breathing, such as an esophageal catheter, the PAV Plus option is far less invasive. A study by Bozeman et al. Showed that proportional assist ventilation improves quality of sleep when compared to pressure support ventilation. Use of the PAV Plus software in the Puritan Bennett 840 ventilator is gaining worldwide attention and has prompted prominent clinical leaders to reach significant conclusions. They have found the software to be easy to use and applicable to a wide variety of patient conditions. A 2008 study, appearing in Intensive Care Medicine, showed that PAV Plus software was appropriate for use in critically ill patients with a variety of diagnoses, including acute lung injury and ARDS, congestive heart failure with cardiogenic shock, COPD exacerbation, and sepsis. In 2007, a management protocol was developed by Dr. Georgopoulos and others, which provides easy-to-follow instructions for the management of patients ventilated with a PAV Plus option. In conclusion, clinical studies have shown that patient ventilator asynchrony is a common problem in the ICU that can lead to increased days on ventilation. The PAV Plus software option for the Puritan Bennett 840 ventilator has been shown to be a valuable tool in the management of critically ill patients. PAV Plus improves Synchrony, and improved Synchrony has been shown to reduce days on ventilation. Reduction in ventilator days may result in lower patient costs and associated risks.